back. I told you I'm going to be having a conversation with a doctor in this hour. Well, the hour is here. I also told you it's a special kind of doctor. You're about to find out. That treats a special kind of patient or subject, if you may. So what kind of doctor are we talking about? Let me head into the report. You'll find out from the very first line. As the world marks World Veterinary Day, critical gaps in Nigeria's veterinary and livestock sectors have sparked renewed calls for urgent reform, especially in River State, where public health risks are mounting. Now, this is the interesting part of this report. Investigations reveal that despite having over 20 operational slaughter slabs, River State is served by only 2 vet doctors in government service. Experts warn that this severe personnel shortage leaves the public vulnerable to contaminated meat, diseases, and overall weak food safety practices. My guest is a vet. He is Dr. Bolaji Ajayi, Chairman, Nigerian Veterinary Medical Association, River State Chapter. You're welcome, Dr. Ajayi.
Good evening, Tom.
How you doing?
Very well.
Okay.
Thank you for having me.
It's a pleasure. Whenever I think of a vet, I think of people who give dogs injections, right?
Yes.
I also consider that there are people who don't think that they are real doctors.
Yes, we have them.
I don't think of it from the livestock perspective
Okay.
because I'm not vegan. I eat meat. Okay. So I don't remember that. Oh yeah, they cover this part too.
Yeah.
I'm just like, oh, they handle pets, and people say, well, if you're not treating a human being, you're not a doctor. So let me ask you, what is your definition of a vet?
So a veterinary doctor is someone who is trained. So he's gone to school. He spent a certain amount of years and acquired knowledge about all the diseases, all the conditions, everything possible that would go wrong with an animal.
Okay.
So an animal, the term animal is broad here.
I knew you were going to do that.
It's broad.
I knew you rope human beings into.
No, not at
into
all. No. Because we don't do humans.
Okay.
We don't study humans at all. So from vet school, we study a minimum of 9 species. So cut across. Now it's much wider because you have wildlife, you have fisheries, and then of course you have the normal animals that we know, the pets, and then the livestock as well, poultry. So they are broad. So we have wildlife, we have aquatic animals, and then we have companion animals, then we have livestock, and then of course we have the exotic animals as well. So it's broad. So the doctor takes care of all of these animals at the same time.
Have you met an animal that you did not know how to take care of?
No, so there's specialization. You are allowed to specialize in a certain field. Okay. So from graduation, I've majored in small animals, and then I do some poultry as well. Livestock, they do come. So as a vet, you're expected to receive every animal that comes to you. The rule of thumb is this. If it is a critical case, give first aid.
Okay.
And then refer to the specialist in that field.
Hold on. Mouth to mouth is one of the
resuscitation, mouth-to-mouth resuscitation, yes.
So you
I've had to do that twice, actually.
To what animal?
A dog.
Wow.
2 puppies. I've had to do that 2 puppies. Yeah.
Wow.
I think 4. Yeah, thinking of it 4 times. Yes. On 4 different occasions, I've had to do that. Okay.
You know those, fictional scenes from movies where people are on a plane and somebody has a heart attack, and they say, "Is anybody on this plane a doctor?" If you are on that plane, say somebody has a heart attack, and nobody answers. If you're on that plane, will you answer?
So, a medical doctor, whether vet or human, is expected to be able to save life at any point in time. So your training gives you that capacity to be able to save life. So yes, at that point in time, if there was a human medic, he would take priority. But if there's no
there's not. You are the only medical.
I'm the only medical person. Of course, I'll step forward.
Okay,
I would step forward.
Now, people address you as Dr. Bolaji Ajayi, right?
Yes, they do.
And usually when you call somebody doctor, we already by default expect that, this person is. Have you ever had to go through your second layer of introduction and say, no, I'm a vet? Or do you just let people believe that doctor is doctor and, that works for me?
So usually I'll introduce myself by my name. I'll just say Bolaji Ajayi.
Okay.
And then if I have to use a title, perhaps they would ask, what do you do? And I go straight and say, I'm a vet.
Okay.
So for instances where I'm addressed by my title, yes, I've had to explain that, no, I'm not a human doctor, I'm the animal doctor.
Okay. So that's just my personal curiosity, by the way. The official interview questions are coming up. Now, let's go to the actual problem.
Yeah.
The ratio of veterinary doctors to slaughters is alarming. You said over 20 slaughter slabs and just 2 veterinary doctors in government service.
Yeah.
Explain how big of a problem that is, because while it seems like a problem to me, I don't know what the ratio should be, right? And what the procedure is. If we have over 20 and just 2 in government service, how bad is it and what danger does that pose?
So it's a huge threat. It's big, really big. It's a massive problem, and it's been there for quite a couple of years now.
Okay.
Unfortunately. So every slaughter slab. So there's the difference. There are abattoirs and then there's a slaughter slab.
Okay, that's good.
So the abattoirs are the standard ones where you expect proper things to be done. There's a hanging rack where the animals pass through. You don't want them on the floor and stuff like that. They're not dressed on the floor. Everything is done suspended. That's how an abattoir should work.
Okay.
So for the slaughter slabs, they are called as much because everything is done on a slab.
Oh.
So it's on the floor.
Okay.
So the killing, the processing, everything takes place on a slab. So that's the difference. So whichever it is, abattoir, slaughter slab, you're expected to have a minimum of 1 veterinarian.
To one
veterinarian minimum to 1 slaughter slab.
So meaning 20 slabs should have 20 vets?
Yes, you should have. For abattoirs, the activities are much on a larger scale. They're expected to handle a large number of animals at the same time. So you'd have them spread over. At a time, you could have, depending on the capacity of the abattoir, you could have 5, 6, 10. So now the veterinarians have a team that they work with. They don't do this alone.
Okay.
So you have a team of animal health workers that are trained as meat inspection officers, supervised by the veterinarian. Of course, the veterinarian is engaged as well in the process of meat inspection. So we are able to identify. So the meat inspection is broad. There's the inspection you do before the animal is slaughtered, and then there's the inspection you do post-slaughter. So at any point in time, you're leading the team. Now, if you're not there, and an animal, a meat inspector who is trained to check meat is there, if he sees anything untoward, he beckons on you.
Okay.
Because you're the one who has the authority. The vet is the one who has the authority to say, oh, sorry, this meat can't be consumed. So he's the one who certifies. Pass, no pass. So the meat inspector cannot do that. He inspects and then checks there's a problem. If there's no problem, fine. If there's a problem, he alerts the vet, then the vet certifies this is good, this is not good.
So that means there is a lot of meat that we have consumed in River State that has not been inspected.
Unfortunately, yes.
Do you eat meat?
I do.
Okay.
I do.
Thank God we are all together.
Yes.
So this is as much a problem for you as it is for us.
As it is, yes.
But there's usually something that they say when it comes to meat, particularly because when you go to buy meat from the abattoir or the slaughter or whatever, the conditions there, the blood and all of that, you might not want to.
Yeah.
But they say it is tried by fire. That it doesn't matter the condition under which it was slaughtered and all of that, but because it goes through fire, it is boiled at, crazy temperatures, whether you're frying, roasting and all of that, that the fire removes all of the... So does that theory not work in some way?
So that's a safe presumption. So I use the word presumption.
Okay.
Because you think it's okay. It goes through fire, fire takes care of. What does it not take care of? But the thing is this. Before you fire it, you handle it.
Okay.
So the process of handling it exposes you to any problem that is there. before you fire it. Okay. So if you're not going to be handling it before you fire it, then it's fine. It's an automated process. It doesn't touch you and all that stuff. Then yes, you could say you're totally safe. But before that fire does its job, you handle it and you're exposed. You're at risk.
Okay, we have a minute before the break. Now, the statement is 2 vets in government service. What does that expression, government service? Is that local government, state government? What does it mean?
So you're supposed to have vets both at the state level and at the local government level.
Okay.
These are public officers. We refer to them as veterinary officers because they're in public service. So you have them in the federal, you have them in the state, and then you have them at the local governments.
Okay.
So these 2 we're referring to are at the state. We don't even have any at the local government.
So only 2 vets in government service in Rivers State?
Yes, the whole of Rivers State. Covering about 3 local governments, unfortunately. That's a sad reality.
I ate meat yesterday. And they do me like say they no check now. Are you kidding me? That's not good.
No, it's not. No, it's not. It's very worrisome. Very, very worrisome.
The break is upon us. After that, we look at how worrisome it is. And World Vet Day is tomorrow.
Yes, it is, 26th.
So stay with us. And here are the headlines. Sam or Kuchinedu here for a better part of the hour. I've been having conversations with Dr. Bolaji Ajayi. He's the chairman, Nigeria Veterinary Medicine Association, River State chapter. And Dr. Nuhu Ibrahim, who's the vice chairman of that same association, has joined us. You're welcome once again, gentlemen.
Thank you, Sam.
Okay. So before the break, I was getting shocked and more shocked at some of the stats that Dr. Ajayi was reeling out and the realities that befall us. So, at this time, we have just 2 vets in government practice. That means that there are many vets in private practice.
Yes, quite a lot of them.
So, do you have to work with the government to be attached to an abattoir?
Yes. You can't just walk into an abattoir to do anything without proper processes. So for the private sector to be able to be a part of what's happening in government, there has to be a synergy. There has to be a private-public partnership to that effect. So we can come in and then, fill up the gap.
Are there enough people studying veterinary medicine?
Yes, we have quite a lot of schools now. Last count, I think we had about 11 universities that are offering degrees in veterinary medicine.
Okay.
And yes, we turn out close to 500 vets every year.
Okay.
So for a population of Nigerians, well, that's not enough, but the numbers are improving. We have grossly just over 11,000 vets.
500 every year from all tertiary institutions in the country?
Yes, from 11 specific, not all tertiary institutions.
Okay, 11. 500 years. I think that's not bad.
Yeah. I have about 11,000 currently.
So Dr. Nuhu Ibrahim, why is the government not recruiting from those in the private sector?
Well, thank you very much. That is a total amazing situation that we are trying to resolve over the years. In government sector, most importantly around the northern part of Nigeria, we have so many vets on their payroll, on the employment of the northern Nigeria. But coming here in the southern Nigeria, probably south Nigeria, so to say, where we have very few of them under the government employment. What this is all about is still somehow a confusing situation.
Okay.
But basically, the need for veterinary services is obviously inevitable, as it is right now, just like my chairman rightly pointed out. Their services are so important for the health of all humanity residing in this part of the country.
Yeah, I can imagine. So this is basically an appeal to government to do what is required. And I don't know, we are in an unconventional arrangement right now. There's an emergency rule in River State. I don't know how to say it, but it's still administrator is still dealing with human beings. So to that say, Vice Admiral, the animals too.
The animals need you.
I don't know how that will be proposed, but that's why the media is here. So, Solar administrators, if you are listening, save our meat. It's very important.
It is.
Okay, so tomorrow is World Vet Day.
Yes, it is.
What kind of awareness happens on World Vet Day?
So World Vet Day is a day we celebrate veterinarians internationally. World over, we celebrate the achievements of amazing people who do great things on a daily basis for animals, for their patients who can't speak. So they have to figure out everything. And we're doing quite a fantastic job. So this day is set aside to celebrate us. And for this year, the theme is Animal Health Takes a Team.
Okay.
So it's not just one person. There's a team that work together to ensure that animals live the best kind of lives that they can. Sometimes this team might be a team of veterinarians. Sometimes it might be a team of veterinarians and support staff. Veterinary nurses, over here we refer to them as animal health technologists.
Wow.
So veterinary nurses, and then you could also have
such a way to package the profile.
So right now we have others that are involved: groomers, nutritionists, pathologists, anesthesiologists, surgeons, opticians, all the works. Everybody is involved, so it really does take a team to be able to ensure animal health. That's what we're focusing on this year. And also on the larger, broader side, there's a One Health concept.
Okay.
Where it's an engagement between the animals.
Someone sent that message on WhatsApp. I know I saw that. Chukuma.
Yeah. So animals, humans, and the environment. There's always an interaction.
Okay.
And the veterinarians are the gateway of that interaction.
Really?
Yes, we are, because the humans are the focal points.
Okay.
What the animals do, what the humans do, affect the environment.
Yeah, naturally.
One way or the other. Now, you also have on the other side of it, the humans consume animals. Humans depend on animals for companionship. Humans depend on animals.
The lonely ones, though. But yeah.
Yeah. Depend on them for security.
They do. Yeah.
So there are various levels of interaction, between animals and then humans. So in that tripod, veterinarians are in the middle of it, because we work both ways, taking care of the environment, ensure that what we do doesn't affect the environment and it doesn't affect humans as well. So
all right. So we're running out of time. Are there any events for tomorrow for the commemoration? Is there something happening?
Well, unfortunately, it's kind of a low-key thing right now. You get it. The government vets are tied up with trying to make sure that everything is okay from down, and private vets also. Yes, we expected that we would have, but this year we're focusing on veterinary skills. We want to see how our members will look at veterinary skills, not just commerce, not just clinic, but what else can you do? There's a lot of skills out there that veterinarians can tap into to broaden their knowledge to ensure that better service is delivered to the populace.
So I owe Chukuma this message because he sent it a couple of minutes ago before you mentioned it.
Okay.
The One Health concept is a collaborative approach that recognizes the interconnection between people, animals, plants, and their shared environment. Approximately 60% of all human infections are zoonotics, including monkeypox, Lassa fever, HIV, Ebola. Therefore, most human diseases can be primordially prevented by focusing on animals' health and diseases.
Very true.
Okay. Chukuma, that's as much as I'll take. He says, I'm a vet doctor, though. Thank you, Chukuma, for sending this. This is amazing. So, for my selfish purposes, please, what abattoirs are those two government? No, please, it's important. You understand? The two government vets that are in River State, where are they attached? Let me know where I'll start buying meat.
So the thing is, like I said, there are meat inspectors at some of these abattoirs, but they're not enough. Okay. And then they need to do more. So we need that engagement more. So we can't really tell because they post them at different places.
Why River State? Why? Okay, we are almost out of time. I'd love to take at least one call. My question is, and very quickly, should meat sellers be required to show proof of vet inspection before selling to the public? Can you tell if the meat that you consume is safe and healthy? And if there was meat safety rating in Nigeria, how do you think your local butcher would score? 0817-923-0002. I'm taking the one call. So if you can make it in time, we'll take it. We have 2 minutes left on the clock. 0817-923-0002. Doctors in the house, what do you make of people eating meat that is not considered meat for consumption? Like there are people who eat dog. I heard that people eat cat. We know about cattle, goats, and all of that. So when people eat those, type of meats that normally is not, is there a problem attached to that? Very quickly. I'll start with you, Dr. Nuhu.
Well, most of the time, the consumption of this meat depends on some traditions, some perceptions. What you see as meat to others may not necessarily be meat.
Okay.
Conceptually, all over the world,
Is it harmful though?
No, any harmful.
So you can eat dragon, eat anything. Hunt down. No, leave Mora. Forget Mora. Right? Medical and health drug. Nothing they happen, right?
Nothing they happen.
Thank you. That's from a vet. The vice chairman.
No, I send it back to differ.
Okay.
Because like I said, contact. You come in contact with those things. Rabies is a huge problem.
Okay.
Right now, as I'm speaking to you in a Boeing state, as at 2 months ago, as of February, they had over 23 cases of rabies.
23 in 1 month.
Over 23 cases. No, over time.
Okay.
Up until February. So it's a menace, is a problem. So you need to watch that.
So eat what your fathers ate. Don't go and start new. Don't start new frontiers.
It's lifestyle.
Thank you, gentlemen, for making the time. We did not have enough time. I enjoyed this conversation.
Thank
you very much, and I wish you happy Vet Day tomorrow.
Thank you.
I'll look at animals differently moving forward.
Oh, please do.
Okay. All right, we have a program coming up now, and at 6, it's the major news. Stay with us.